Hi, in this video, I'll be talking with you about how to talk to the people around you about your breast cancer diagnosis. I'm going to cover when should you share, who you should talk to, how you should share, what to do when people say the most unhelpful things, and then some other things I've learned from my patients about their experiences when they've talked to other people. So first of all, when you're first diagnosed, it's very likely you told other people in your life that you might have breast cancer. And now you find out that you do. How do you share that? Well, first of all, you have to figure out how you're doing. You have to figure out, are you okay? Are you distracted? Are you freaked out? Are you scared? Are you surprisingly detached? It's important to check in with yourself, maybe as you reach out to others, and sometimes before you reach out to other people, depending on who it is. So for example, your best friend, or your partner, or a child, a grown child you're very close to, or your mother, those folks, you want to reach out to them immediately so you don't feel alone. Other people in your life, maybe a friend you've not talked to lately, or your boss, or a coworker you've had some conflict with, this you'll want to be very thoughtful about. You'll even want to know a plan before you talk with them. And don't hesitate to ask your doctors or your medical team, other folks on your medical team, when's a good time to tell my employer? When's a good time to tell people at work? The next thing to talk about is what to tell them. A lot of times people are going to be really anxious because they care about you. And you might decide to withhold some information. Maybe you don't want to tell them if you're going to have chemotherapy or you're going to have reconstruction, or you don't want to tell them a lot of details. This is your body. You don't want to tell them you're going to have a certain type of surgery. It's not really their business. This is your business. One of the things I've learned from some of my patients is that if you tell everybody very quickly and you tell a lot of people, you can't take it back. You can't untell them. So this is where talking with that person you're super close with. Now, it may not be your partner, may not be your husband, may not be your wife. That may not be the person. But reach out to the person who you find most supportive, who you think can, what we say, hold space for you. Just sit with you and let you have your feelings. And then figure out when you're ready to tell other people. Or you might be completely the opposite. You may want to tell everybody. You may tell folks on your Facebook page. That's okay too. This is up to you. But I think it's important to know, how are you feeling? Do you have a supportive person that you can bounce things off of right away? You want to make sure you feel safe and supported. Now, there are a lot of folks in your life who are going to hear this news and wonder, what does this mean for me? I hate to say it, but that's really how we all are, right? So I've had my, adult patients tell their adult children. The kids are surprisingly unsupportive. Turns out that the daughter wonders, am I going to get breast cancer? So, my kids are early 20s. If I told them I had breast cancer, I would not be surprised for them to think they're also going to get breast cancer. So as much as I would wish them to hug me and say, oh, Mom, we got you, you're going to be okay, we're going to take care of you through this, I wouldn't be surprised actually if they were more anxious. And it's only through the years that I've been doing this that I've learned mothers, sisters, brothers, nieces, cousins wonder, does that mean that they're going to get it? So don't be surprised if that's what they react to. Your partner may wonder, am I going to be left? Are you going to leave me? And so they may not react the way you want them to. This is why, it's really important to reach out to people who can have your back and support you. And folks at work, when they hear you have breast cancer, your coworker may be wondering, how am I going to pick up their work? Your boss, who views you as incredibly valuable, may be anxious. How's he going to manage the days that you're getting treatment or after surgery when you're in recovery for a few days or weeks? So that's what's going on in their mind. And what that can do is make people say things that aren't particularly helpful. So a lot of my patients have told me that they tend to share sort of on a need-to-know basis some information, and then keep those who can support them much closer. Okay, now I'm going to cover something you've probably already encountered, people saying things that are not helpful. I'm going to say some things that people will tell you, and then I can tell you what I've learned about why they've done that. Not that that makes it okay, but it can sometimes help. So one of the things you'll often hear is something called at leasting, at least this, or you'll be fine. And this is because people want you to see the sunny side of things. Why is that? They want you to be okay. Either they can't handle heavy information right now, or like I mentioned a moment ago, they're anxious and concerned, or they want to know you're going to be okay, so they're going to tell you you'll be all right. They will tell you everything's all fine. Now the opposite end, and this is something that I find sometimes incomprehensible, but it happens. If you tell somebody you have breast cancer, sometimes the first thing that comes to mind to somebody is somebody they know who died of breast cancer. This has happened to somebody I know who was in a grocery store who was wearing a scarf because she'd lost her hair from chemotherapy. And somebody reached over at the grocery store and touched her hand and said, "Oh, my sister died of ovarian cancer last year." And my patient said to me later, "Who am I in that story? Who am I? I'm the person who didn't make it. This is not helpful." People just don't think. Does that mean you have to forgive them? Absolutely not. But sometimes it can be helpful to realize why people do this. It's the first thing that comes to mind, and they just don't think about this from your point of view. The other thing they can do is hover. This is something I call husbands who hover, St. Bernard's husbands. And these are the patients who come in with their husband to see me in the office, and the husband is just looking at his wife and so worried and hovering. And that patient may come into treatment without him because that energy is just so heavy. Again, these are very loving husbands, partners, friends, parents, kids. But sometimes it's just okay to leave them at home or tell them what they can do to be helpful, whether it's taking notes in the doctor's office or bringing you snacks or ice chips or maybe sitting out in the waiting room or keeping the car warm with the dog, if you know what I mean. So it's totally okay to tell your partner, those supportive people kind of drain your energy, just to take a back seat and tell them this in the most loving way. And they will be fine with that. They'll be just fine. The other thing people will do is tell you what they did with their treatment. Now, they may not have even had cancer, but they'll tell you how to manage your doctor's appointments and how to feel the best you can and that you should be running 6 miles a day. Not helpful. So you just say, this is what my patients have taught me to say, they just say, "Thank you so much. I appreciate your concern." And you just smile at them. Don't let it sink in. Just let it ripple off you like water off a duck's back. So those are just some of the responses. I have patients who have whole lists of things that people have said to them, and they keep them and share them with other people who've gone through the same thing, and they can have that sort of, "Can you believe they said that?" reaction. And you'll have your own collection of things people say. So next I want to tell you a couple things that a lot of my patients have told me that they would have liked to have done differently. It's very much the case that these may not apply to you. But one thing that my patients have taught me is the impulse to take care of everybody else can be really hard to resist. You see people around you suffering. They're worried about you. They're scared. They might be hovering or be a St. Bernard. And it's really important for you just to focus on your health, your treatment, and your needs. This can be really hard, right? I mean, we're used to taking care of everybody around us. We take care of our coworkers, we take care of our kids, we take care of our parents. For this time in your life, take care of you. Reserve your energy for you. We have another video on how to get through your treatment, how to ask for help. And that would be something worth looking at because it's got some daily tips and tricks. But it's really important for you for this time in your life to focus on taking care of you. You're going through a lot right now. And that extra burden that you're carrying on your shoulders of, should I volunteer for, or I said I would, this is an okay time to say, I won't be able to do that at this time. Ask me some point in the future. So I've covered a lot. I've covered how to tell people, what to tell people, the things you might hear that aren't so helpful. We actually have another video you may want to show to the people around you covering how to support your loved one or friend going through breast cancer diagnosis and treatment. You can have them watch that, and it will give them some tips and tricks. And we've also covered some things to keep in mind and things maybe not to do. I hope this has been helpful for you. Remember to visit Yerbba.com for your personalized report. And also, if you like this video, click like and subscribe so you might see other videos that are helpful and other people could find this video as well.